Today I will talk about overactive bladder. Hello everyone, I am Dr. Sunny Goel. I am a consultant urologist at Epitome Hospitals, New Friends Colony. What is overactive bladder? It is urgency which is usually accompanied with increased frequency of passing urine. Urgency is a compelling desire to pass urine whenever you feel there is a need to pass urine. So what is that urgency? Normally, a normal person, when he has a desire to pass urine, he or she can wait for 5, 10, 15 minutes or maybe for an hour before passing urine. But in overactive bladder, there is urgency. That means you have a sudden compelling desire. You have to rush to the toilet to pass urine because you have a fear that you might leak urine in your pants or your clothes, or you may actually leak it. It is usually accompanied with increased frequency of urine. Usually the frequency of urine is less than 8 times in 24 hours, and when there is a need to pass urine more than 8 times in 24 hours, we call it as that you have an increased frequency to pass urine. So a conglomeration of both these symptoms is called as overactive bladder, especially in the absence of infection. So this overactive bladder is more common in females, especially at old age. There are certain risk factors which includes a patients with diabetes, with neurogenic bladder, patients who have prior history of pelvic surgeries like hysterectomies in ladies, and patients who are obese or who are constipated. So whenever you are suffering from these symptoms, do not consider it as it is a part of normal aging, because it is easily diagnosable and it can easily be managed, especially with the help of medicines. Otherwise, it becomes a matter of embarrassment to the patient. They feel shy, feel as if they cannot attend meetings, they cannot go out with friends, they cannot go on holidays, because they always have a sudden urge to pass urine, and they always think whenever we will go out, we will have to search for toilets, washrooms, and hence it becomes a bothersome symptom. So when any of you are suffering from these symptoms, like I have told, you should visit your nearby urologist, or you can come to our hospital. First, we take a detailed history of your urinary pattern and what complaints you are facing. Then we do some basic tests which includes urine routine analysis, your diabetic status, to rule out other common conditions of these similar symptoms. And once the final diagnosis of overactive bladder is made, then we go to management. Management is usually divided into two parts: behavioral management and the pharmacological management. So what is behavioral management? It includes your fluid management. We always ask our patients to reduce their fluid intake to less than 2 liters in 24 hours, including all types of fluids. If you are obese, we would like you to reduce weight, to treat your constipation, and especially in ladies, we will tell them to do Kegel exercises properly. All these lifestyle modifications are really beneficial for the treatment of overactive bladder, especially in long term. Certain patients who are not benefiting just by lifestyle modifications, or who are suffering from severe intensity of symptoms, we start them on pharmacological management. These are usually in the form of medicines, drugs, which are usually recommended for 6 weeks. There are very basic side effects which we always explain to our patients, and it has been seen that 80 to 90% of patients usually get cured with the help of lifestyle modifications and these medicines. Certain patients are refractory to these medicines, for which we go to third line of management, which can be in the form of intravesical Botox injection, which gives relief for 8 to 9 months. So friends, if you or your nearby relatives or your neighbors are suffering from these symptoms or condition of overactive bladder, kindly do not ignore it and do not consider it as a part of normal aging. It is very easily diagnosable and treatable and curable. Thank you so much.